Chelsea, how's it going?
Pretty good, but I'm actually a little nervous because I have my annual exam coming up at Student Health, and I don't know what to expect.
Oh, don't worry about it. It's pretty easy. To make an appointment, you can either go to the website, call Student Health Services, or talk to the person at the front desk.
Oh, can you show me the website?
Yeah, sure. Okay, so it's studenthealth.ucsd.edu.
Okay. But it says here I have to attend an info session.
Yep.
Do I really have to go to that?
Well, it helps you get a better understanding of your sexual issues such as anatomy, birth control, STIs, which is STDs. It's just sexually transmitted infections, and then it gives you an overall view of what's going to happen at your annual exam. It's taught by trained students called SHAs, and they explain everything really well, easy to talk to, and everything is kept confidential.
Okay, that's good to know. But I mean, I already know a lot about STIs and birth control, so can you tell me what I can expect during the exam?
Okay, so first is your breast exam, then your pap smear, and then a bimanual exam.
So I've heard of the pap smear actually. Isn't it where they take a giant Q-tip and put it inside? No.
No. The physician will put in a speculum into your vagina, take a swab of cervical cells to check for any abnormalities, and then while you're there, you can also ask to get tested for STIs.
Okay, good. That's like killing two birds with one stone.
Yep, exactly.
So what about abnormalities though? I mean, what could be wrong with my cervix?
Well, 15 to 20% of all abnormalities are kind of due to inflammation from STIs. But have you heard of HPV?
I think so, but I don't really know what it does.
It's an STI that can cause genital warts or cervical cancer. And so if there are any abnormalities, the doctor will test you for HPV when you come back.
Oh, okay. So what about the bimanual exam? I know bi means two and mono is hands, but what are they doing with two hands?
It's actually 2 fingers. With 2 gloved fingers, the clinician will put it into your vagina, push onto your abdomen, and then feel for your ovaries, your uterus, and your fallopian tubes just to make sure everything's healthy. It's a little uncomfortable, but shouldn't be painful.
Okay, that's a relief.
Yep.
So I know it's not going to be painful, but there's still a lot of poking and prodding. Like, is it all necessary? Won't I know if I have an STD?
Well, actually, most people don't know, especially women, since usually there aren't any signs or symptoms. That's why it's really important to get tested at least once a year to detect if you have an STI or develop cancer.
Yeah, I mean, I've heard of the STIs that are incurable, like some SHA was talking about the 4 H's.
Yeah.
So I think it's herpes, hepatitis, HPV, and HIV. What about the curable ones, like gonorrhea, syphilis, chlamydia? Can those really do me any real harm? I mean, can I just take a pill and they'll go over with?
Well, yeah, they can be treated, but you gotta get tested in order to check if you do have STIs or develop cancer. So that's why it's really important. And if they're not treated, then they can develop pelvic inflammatory disease or even infertility. Okay, so do you know where to go for your info session and for your appointment?
Well, I know I can check the times on the website and locations. And I guess if I forget, I'll just ask someone at the front desk.
Okay, good.
Yeah.
Okay, so just make sure that for your info session, show up on time. You don't have to make an appointment beforehand. And then for your appointment, fill in the slip and then give it to the front person, whatever group you're in.
Okay. So how much is all this going to cost me? I mean, I'm a starving student, you know.
STI testing, it kind of varies, but most are covered.
Okay. So first I'm going to go to an info session, then I'm going to make an appointment, and then I'm going to check in at the group. So what else should I do beforehand?
Well, you shouldn't douche beforehand, which you shouldn't do anyway. And then no sexual intercourse, no vaginal medications at least 24 hours before your appointment. And then also make sure you do not set up your appointment during your period.
Yeah, that could get kind of messy. So one more thing. When do I get my results?
Well, when you come in for your appointment, you're going to be asked 2 options. You can either pick it up a week later at the clinic, or you can have it mailed to you.
Okay, great. Well, thanks for talking with me, Lori. I really appreciate it. I feel a lot better now.
I'm glad. No problem. I'll see you later.
Yeah, bye. Bye.